What an exciting afternoon for UGHE today, almost the last day of the quarter. And I'm so happy to have you join us this afternoon, this morning, and from wherever you are in the world. My name is Judy Hanyola, and I'm the chair for the Center for Nursing and Midwifery at the University of Global Health Equity. And this next hour, we're going to talk about everything nursing and midwifery with a focus on nursing leadership. And we have an exciting lineup for you, an interview with one of the topmost nursing leaders in the world. I'm so excited that she's been able to join us. But before we go through that, I'm going to invite Professor Agnes Binagwaho, who is our illustrious and esteemed Vice Chancellor at this wonderful university that I'm privileged to work with. Over to you, Professor Agnes.
Good afternoon, good evening, or good morning to all of you, because I know that you are joining us from around the world today. Especially thanks to join us to the Chief Nursing Officer of the WHO, Elizabeth Iro. I am delighted to welcome you to this timely webinar as UGHE Center of Nursing and Midwifery launches its new executive education program, Global Leadership in Nursing and Midwifery. Now, today, more than ever, it is imperative to highlight the critical role nurses and midwives play in delivering healthcare around the world and saving lives. I want to start by acknowledging their continuous hard work and the many sacrifices they make day to day, especially during the challenging time of this pandemic. We send our gratitude to all the nurses and midwives around the world. We appreciate you. Globally, nurses and midwives make up the largest portion of healthcare workers. They play a crucial role in delivering healthcare services and in promoting health in their communities. They contribute to not only improving health outcomes, but they also serve at the front line of health crisis. They are key to empowering patients to participate in their own health and to addressing, for example, maternal and child health care, among others. But everything, mental health and all the diseases in household or in hospitals. They do so by interacting continuously with patients and their families. This makes them well placed to understand their patients' needs and the social determinant of health. In Africa, nurses and midwives form the bulk of the health workforce. They are often the first and only health professional their community members will see and ask for help. However, most countries in sub-Saharan Africa have less than 20 nurses for 10,000 people, making it harder for communities to access health services, especially for the vulnerable. The majority of the population receive health services from a nurse or a midwife. It is crucial to address these challenges of number. The role of nurses and midwives has been more evident during this pandemic. In all communities, nurses and midwives have been at the front line providing support, treatment, and care for COVID-19 patients, while continuing to provide essential healthcare services. Health threats such as COVID-19 pandemic have shown that it is crucial for nurses and midwives to expand their role in healthcare service delivery, to be recognized to be able to do so, because they were key in the pandemic response. But for this, we need to increase their known leadership. it's not only the number of nurses that we need to work on, it's also the type and the quality of the nurses. At UGHE, we are already providing holistic education in our curriculum. We teach our students to care for patients by looking beyond the bedside and clinical diagnostic, to examine the larger social determinant of health. To this end, our students are trained to integrate holistic knowledge and skills into practice, to management, and to policy making in order to improve their patient outcome. So, reduce the shortage of nurses and midwives is important, and improve their quality is also essential. So, it's essential to train and build their capacity in not only the right clinical skills, but also in the right managerial, financial, digital advocacy, as well as leadership skills, to use this expertise to ultimately advance the global health equity. As countries continue to reform nursing and midwifery education, UGHE, through the launch of this program, is committed to provide to nurses and midwives the knowledge and expertise necessary to enhance their problem solving and critical thinking, and the skills for their day-to-day work in clinical setting to transform the life of one patient at a time and influence the health of their communities locally, nationally, on our continent and beyond. Our objective is to train and empower the next generation of nurses and midwives to continue to be the leaders and managers they are now in their wards, in hospital, in health center, in health posts across the world. With the new skills they will acquire, the knowledge they will acquire, they will be capable of finding sustainable solutions to support their countries to provide equitable quality services and to influence policies that address the greatest global health challenge, leaving no one behind. Thank you, Judy. And again, welcome to all of you.
Thank you, Professor Agnes. Thank you very much for those framing remarks, which were extremely accurate. Nurses are the quality and the equity in healthcare that we need. I would like to invite Professor Abebe Dekele. He's our Deputy Vice Chancellor for Research and Academics and the Dean of the School of Medicine. Professor Abebe, over to you.
Thank you very much, Judy. Thank you very much, Vice Chancellor, for your opening remarks. Dear colleagues, friends, good morning, good afternoon, good evening. Well, on the behalf of the faculty, the staff, and the students at UGHE, I would like to welcome you all to this 1-hour webinar. As you all know, nurses and midwives form the bulk of health workforce in Africa, and often are the first and the only health professionals, communities, and the population face. They form the official link between the population and the healthcare system in almost all countries. In addition, the rural area where more than 70% of the population of Africa lives, nurses are the backbones or the pillars of the available healthcare delivery. By healthcare delivery, I'm referring to making a proper diagnosis, appropriate referral and timely referral to health centers, health posts, and hospitals, provision of delivery in the community, and sometimes follow-up after care is delivered in the hospitals and in the clinics. Not only are nurses and midwives involved with health care provision, but they are usually responsible to organize, coordinate, and lead healthcare systems. If you look at the most advanced hospitals in the world, let alone Africa and the developing world, such as operating theaters, surgical care systems, outpatients, antenatal care, delivery and postpartum care. These are usually and preferably led by nurses who know how to do the work properly, even without receiving quote unquote appropriate leadership trainings. They know how to get the job done. If you look at health professionals in institutions like nursing schools, midwifery schools, deans, deputy deans, vice chancellors, department chairs are nurses. And there are institutions, such as the institution where our distinguished speaker came from, there are nurses that sit at high places in ministries of health, at the WHO, at policy-making bodies that do the job absolutely fantastically. So nurses play a crucial role in the delivery of healthcare and leadership in the world. And for populations in Africa to receive quality healthcare, nurses and midwives need to be trained in leadership at the highest level so that they are able to bring the unique role of nursing to the decision-making table. In other words, nurses and midwives play a significant role in access to care. By access to care, I'm sure all of you know that the mere presence of a hospital building does not define access. Access is defined as physical availability, availability in sufficient quality and safety, with the most appropriate capacity, and affordability. So these four pillars define access. Nurses play a very important role. Midwives' role play a very important role in access to healthcare delivery. Therefore, fair conclusions can be made in all health care metrics, called, say, the SDGs, the Lancet Commission recommendations, and so on. These cannot be achieved without due emphasis and focus on the development of nursing and midwifery workforce, especially in this part of the world, in the developing part of the world. That is why UGHE has established its Center of Nursing and Midwifery about a year and a half ago. We are very lucky enough to be working with dedicated partners in terms of financial support, academic and resources support. We have included nursing and midwifery as one of our pillars in our academic and research affairs, especially relevant to problem solving in the region, and community engagement and community-based education tuned around nursing and midwifery. And hence, we are now discussing about launching a leadership program in nursing and midwifery leadership. Without further ado, I would like to introduce our distinguished speaker for this afternoon. I'm very privileged to invite the Chief Nursing Officer of the WHO, Ms. Elizabeth Iro. Ms. Elizabeth is the WHO's Chief Nursing Officer, CNO, who commenced in this role in January 2018. At the moment, she's based in Geneva, Switzerland. Ms. Iro is from the Cook Islands prior to taking up her role in the WHO, and she served her country as Secretary of Health since between 2012 and 2017. She was the first nurse, midwife, and a woman to be appointed to this role in the Cook Islands. Her country's health, her priorities while in this role focused on legislative reforms to strengthen the country's health care system and developing the national health strategic plans for 7 consecutive years and a national health roadmap between 2017 and 2036. Ms. Iro was trained in New Zealand as a nurse and midwife and holds an MHSC in nursing and an MBA. She held various nursing roles such as Chief Nursing Officer, Registrar of the Nursing Council, as well as the President of the Cook Islands Nurse Association. I'm very sure I summarized her vast CV and I did not do any justice to it, but Ms. Iro, thank you very much for joining us today. The floor is yours. Thank you very much.
Thank you very much, Professor Abebe, for that introduction. First of all, I'm really delighted to be here today. And I want to thank you, and I want to thank actually everyone, all nurses and midwives who are listening in. I want to thank you for the tremendous commitment and the courage, especially during the last year. It has been a really unimaginable, difficult time for many of us. Our nursing leaders around the world have been facing huge challenges in the fight against the pandemic. And we are grateful to everyone who has worked so hard to support our nurses and our midwives in the difficult work that they are continuing to do. And I also want to say thank you to Judy Caniola for inviting me to this webinar. And I'm also wanted to extend my appreciation to Professor Agnes and to Professor Abibi for what you're doing in your capacity in your university to strengthen nursing and midwifery, and especially in nursing and midwifery leadership program that you've initiated in your university. So I think this is a really significant program. I think that will go a long way to taking our nurses and our midwives into the next, century. So I really appreciate what you are doing. So thank you very much. I understand that we were going to go through a type of a Q&A that Judy was going to take me through. So I'm kind of see how we go with that, Judy. I look forward to see how we kind of progress with this. But I think in the process, I do anticipate that it will kind of provide some perspectives into nursing and midwifery leadership overall. So thank you very much, Judy.
Thank you so much, Elizabeth. Thank you, Professor Agnes. Thank you, Dina Bebe. It's obvious and very clear that nurses and midwives are critical, especially here in Africa, in the provision of equitable and of quality health services. The Center for Nursing and Midwifery is really passionate or working hard towards ensuring that the type of nurse that comes out of our university, of our programs, is that nurse who is going to have not only compassion, but also competence. I'm very keen that our nursing in Africa changes and that we have competence built into the nurses that come out. I have worked for many years in my own career as a nurse and a midwife, caring for people. And I always feel that what we need so much more than anything is a competent health professional at that point in time. Like both Dina Bebe and Professor Agnes have said, in Africa, a nurse and a midwife is often the only health professional that communities will see, and is very often the first point of contact with a formal healthcare system. And so we need this person, this individual, to be competent clinically, but above all, to also have compassion, because that's the heart of nursing. And I'm keen that as much as we have the competence and the scientific knowledge and rigor, that we still maintain the heart of nursing. So Elizabeth, thank you so much for joining us. Thank you so much for being part of us this afternoon. Colleagues from around the world, please, as we go through this, back and forth interview with Elizabeth, please don't hesitate to put your questions in the chat box. There's a chat box available that please you put your questions, and at the end we'll have an opportunity to answer these questions. So Elizabeth, just we have heard a little bit about you. Could you share with us some of your own journey to nursing leadership, and what brought you to become a nurse leader and even work at the multilateral level that you currently are in?
Well, Judy, I think you heard Professor Abibi talk about my, some of my background, how I kind of progressed through my career. I think nursing leadership, you find them at various levels. So I think in the roles that I played, during my clinical practice times, I think really contributed to really strengthening my perspectives around, how to take nursing forward. So I think, my role as a registrar of the Nursing Council in the Cook Islands, allowed me to work with really influential women. And one of them was actually the Speaker of our Parliament, the Speaker of the House, very influential, and also some very influential nursing leaders. I think that provided the oversight and authority to regulating nursing and midwifery education and practice. I think for me, those were kind of key moments that kind of crafted some of this, if you can call it, leadership foundations. And then, of course, as the president of the Nursing Association, I actually led a negotiation for improved staffing level and increased remuneration for nurses. And I have to say, this came about, I think, as you build your skill sets, as you move up, to address events or components outside of nursing practice. I have to say, I'm very grateful to ICM, who at that time had provided some documents on leadership for change. Now it was a program that I kind of filtered through to support me in how to negotiate to improve the staffing level and also to increase the nursing remunerations through discussions with the Public Service Commission or with ministers of health, and also with colleagues within the Ministry of Health. So I think those, help contribute to that foundation. And of course, the role I took on as the Secretary of Health kind of further exposed me to, beyond nursing and beyond the Cook Islands. It took me to the regional platform and to the global platform for health. So kind of just going outside of the realm of nursing. Also kind of perhaps, build some of this, helped contribute to this foundation, as a nursing leader. So I was really grateful for all of those, for those opportunities that I had. And I think, if there was something I kind of can say to reflect, what I was kind of perhaps saw coming through this area was really to see the expanding role of nurses in my country. That I saw the scaling up and the continuing professional development that enabled nurses to work and function as lead primary health providers in most of our remote islands. This was about interdisciplinary team support, the use of technology, and also strengthening our referral systems from and with colleagues on the mainland. Now, this was about building capacity and strengthening health systems. So I think I had to, I saw the strength from the perspective of, a nurse leader, as well as seeing the growth of these nurse leaders, young nurse leaders, in their capacity as primary health care providers. So I think for me, that's been really a proud moment for me to see. And I know that similar scenarios have happened in many other countries, and we should be proud of those achievements that we see in our practicing nurses and midwives at country level. Now, I've been at WHO now for 3 years, and throughout this time, of course, I've had the privilege to meet many nurses and midwives who are great leaders. They're not only in government positions, but they are in hospitals. They lead their teams and in community projects. They teach each other and they advocate for better health. They're in universities. And they're also, within the COVID-19 kind of time, we've also seen, these nurse leaders lead in the vaccination rollout programs. So I've also seen some amazing aspiring young leaders, many through the Nursing Now program, a campaign for safer care and greater access to health. So I'm actually quite inspired by the talent and the energy that nursing and midwifery leaders bring to the difficult challenges our profession faces on a daily basis. And we continue to navigate our way through the COVID-19 pandemic. It is clear to me that we need to support our young leaders that we are around, that surround us, and also to establish pathways and opportunities to grow leadership capability and strength so that we are fit for the future. As you just rightly said, Judy, it's about making sure that we are graduating nurses with with quality education, with the right competencies and standards, and that they are fit to work. They are fit for the future. So I think for me that's really important. If I may also reflect, Judy, I would like to kind of share with you a project that my office has recently undertaken. It's a piece of work to understand more about the challenges faced by nursing leaders. We recognize that this year, more than ever, the demands on our nurse leaders, yourselves, your colleagues, have been enormous. The decision we had around this topic raised on interesting questions around, for us internally during my daily meetings with my small team, how would you help your young self as a young nurse to prepare to be a nurse leader? Many of us come into this profession because we wanted to make a difference. Many of us remain in it because we can see the impact we make, either in the clinical, in academia, or in management areas. We see the influence we have and continue to make a difference to the people and families we care for and to the society as a whole. For me, choosing nursing was because I wanted an opportunity to travel together with the security that I could be, I could get a job anywhere in the world. But actually, on completion of my training, I realized that it was seeing the difference I made to the patients and their families that I cared for that kept me in this profession. So my 20-plus-year-old self found that purpose. And so I was determined to focus on making a difference to the lives of people. And leadership is mainly, therefore my role, in WHO has allowed me to even make more difference to the lives of people that, our people that we care for through strengthening nursing and midwifery. And I think, you said something quite significant to Judy in terms of compassion. I think, compassionate leadership is about developing that vision, allowing individuals to work towards that vision. It involves creating a shared mission, understanding and tackling political, organizational, and resource barriers, and at the same time inspiring and motivating others. I think that's compassionate leadership, and it empathizes and care for them to take action to help and support them. In times of crisis, compassionate leadership is critical to situations that are frightening and overwhelming. And we have had that experience with the COVID-19. And as I said, I believe that our recent grounded experiences in leading the response to the COVID-19 pandemic will be a powerful source of inspiration to draw on and to learn from as we teach others how to lead in times of crisis. And I must say at this point, I want to congratulate you and your colleagues in your Ministry of Health in your country for your response and management to the pandemic and really minimizing the cases and the deaths in your country. We do have a lot to learn from each other and from you, and your shared experiences, I believe, could go a long way in terms of providing some of these leadership skills that you, from action, can, continue on to providing that learning to future graduates of nurses. Thank you, Judy. Sorry, that's kind of quite winded, but I just felt it was really important to capitalize on some of the learning, from our own experiences that we could kind of take forward in developing new nurse leaders in the future.
Thank you, Elizabeth. And absolutely, what you're saying is so critical at this particular point in time when we are battling COVID. And more, when you look at even Rwanda, like you have said correctly, I am always struck how leadership, I think, is the cure to the healthcare crisis we have in Africa, rather than any other thing. And Rwanda demonstrates this so well. And as we move forward in Africa within the realm of nursing and midwifery, it is important for us to realize that the role of nursing and midwifery has changed from, for example, when you're talking about your 20-year-old self or my 20-year-old self. At that time, nurses and midwives were pretty much restricted into certain areas. So Elizabeth, what would you say the role of nurses has changed over time as we look at the 21st century, as we look at the year and some months we've battled COVID, that would now necessitate leadership training based on your own experiences? And like you've explained correctly, the opportunities that have been availed to you in leadership. What are some of the roles that nurses and midwives can play now that would really necessitate leadership training that would help many people even listening to us this afternoon to perhaps find a solution, because they probably don't know? But if we can explain and show them what has changed in nursing and midwifery now in March 2021, which was different 10 years ago or 20 years ago, can help somebody say, I didn't look at it that way. And perhaps this is an area I can play towards help make healthcare provision and service delivery much better.
Thank you, Judy. I think you're quite right. I think there have been many changes over time in terms of the role of nurses, but I think there have also been some aspects of nursing that has not changed. I think, if I can perhaps kind of reflect on some of those that have not changed, I think from the times of Florence Nightingale and her work around infection prevention and control, around data collection to make the policy changes. I think those are some of the critical elements that still exist. I think that we need to definitely be maximizing on continuously. But I think also there are changes. There have been changes. And I think, nurses will take up more extensive roles in the future, especially as we see the rise in aging population, an increase in non-communicable diseases, including mental ill health, and the increases in communicable diseases. We're probably going to be seeing more similar pandemics to COVID-19. So I think these are the landscapes in health, I think, that will continue to change. So additionally, with that comes the changes in science and the technology, change in climate change that we have seen that's impacted many countries already. And I've seen that change specifically from my side of the world, in our small island development states, where the climate change is a big impact on health and also on nursing. We've seen the changes in politics and the economics, and these will have impact on nursing and the nurses' roles. The practice of nursing, along with other health professions, has been changing over time. So, we've been adapting to technological changes in the health sector, with also the adoption of practices based on scientific evidence. We've seen nurses adapt and take on a wider scope of practice, and we've seen them take up leadership roles in many fields, from primary healthcare practices to advanced nursing practice to prescribing rights, managing non-communicable diseases as in nurse-led clinics. And we've also seen midwife-led continuity of care models. We've seen nurses in various countries undertaking surgical procedures. And I know this is for in the Afro region with the work around HIV. There's been some upskilling of nurses with to do circumcisions as part of that work. We've also seen nurses, taking key roles as being first responders in emergencies and crises. And I think we've seen a good example of that in the way that nurses responded to COVID-19. But I think, overall, I think we've seen the use of telehealth technology. We can say this is a 21st century approach that is patient-centered. It allows, as I said, in my previous experience around those remote areas where nurses have the availability of some of these technologies to a certain extent, can provide excellent patient care services. But I think all of this will require different understanding and reforms in the systems of training and the permanent education of nurses and all healthcare workers. I believe that health professionals, however, will still need this interprofessional communication skills. And we need to kind of maintain this to achieve high levels of our patient participation in their treatment regimes. We can't afford to lose the art of our hands-on care and the compassion as nurses play fundamental roles in communication to their patients, their families, and the communities that they tend to work in. And as you've heard in our previous two professors mention, because in many communities, nurses are the first point of contact with the health system for most people. And for some, the only point of contact. So I think that's going to be, a critical change for nurses and for healthcare in general going forward.
Thank you, Elizabeth. This UGHE Executive Education Program is actually taking cognizance of this role change that you've mentioned so correctly around non-communicable diseases, around politics and economics, around technology and digital health, climate change and mental health and aging, and even things around, pandemics and nurses, like you say, being at the first responders or being part of early warning signals. So all of this has been embedded within the program that we are launching today that UGHE is offering for nurses and midwives in Africa and the low and middle income countries. So Elizabeth, what would you say are the changing roles of nursing leaders throughout healthcare and governance? Because it's important that in as much as we will create or build nurses through this training program or through this executive education offering, we want to make sure that then these nurses are absorbed and are then able to do their work. So what do you perceive to be these nursing leadership roles that need to be played to make sure that we have a change and we see a change in the healthcare, especially here in Africa?
Julia, it's really interesting question and how you've actually, positioned that question. What do we want to see in our nursing leaders? we've kind of been talking about, in various platforms, how we want to see nurses at the policy decision-making table. So how do you equip nurses to do that? I think there's and is there a set program to get nurses in these roles? I've always kind of believed that nursing leaders exist at various levels of a healthcare service delivery. And so therefore it is about what the priorities are for a country in terms of their health needs. And then, focus the programs around strengthening nurses' skill competencies around those programs. As I said, whether it's around non-communicable diseases, communicable diseases. I think, policy decisions that impact from that technical point or disease focus, I think is important. But I think it's also important that we go outside of those health focus and ensure that nurses are also getting a focus around the political environment that we live in, that the economy of our country. I think, finances is really critical to equipping our future nurse leaders, which we don't really think about when we're doing these undergraduate programs. So we're focused on getting and rightly, what nurses do, the right competencies, but I think it's important to also take a scope outside of those to start getting I suppose I'd call it tweaking the interest at a very early stage in terms of the political, the economic, the financial, and even education and the interdisciplinary aspects that they may kind of be engaged in the future. I think are elements that could be very useful. I say this also because I think, when you get through the levels and you're sitting at as a chief nurse in your country, you need to be a bit savvy in how you negotiate and how you how you put and articulate your contributions that's needed for your nursing and midwifery workforce. So I think that's an element I think needs to be quite varied. I really think we've kind of seen how this global pandemic has disrupted lives, livelihoods, economies, impacts on patients, impact on nurses and midwives, and impact on healthcare workers, impact on families. So, the pandemic is really highlighting and exploited the vulnerabilities of our healthcare systems, as well as some of the societal inequalities. I think these are elements, that I be kind of quite keen to see being, I suppose, provided very early in a young nurse's aspects. And so I think, these are extraordinary times. And really what I have seen as a result of this past year as nurses have responded to COVID, I've seen nurses and midwives actually contribute to the production of our first stage of the World's Nursing Report in the midst of a pandemic. We've launched our very first ever State of the World's report that has captured what nurses profiles for countries. It's just been incredible. And I think that took a lot of leadership at country level to make that happen. and, you know, not just within government, not just from the clinical area, but also from the education contributions to that report. And we're about to see the launch of our third State of the World in Midwifery report, not next month, in May, and also the next iteration of our Global Strategic Direction for Nursing and Midwifery. Also, that this will be out in, you know, before our House Ministers in May. Now, all of this, you know, speaks volumes to nursing and midwifery leadership. So we have definitely a lot of lessons to learn from, you know, from the challenges we've just actually gone through. But I think that's, for me, I think some of those key roles that I would like to kind of see kind of played out. I hope that's kind of responding to those questions, Judy.
Yes, it really is. And I think what I get from your answer is that, first of all, we need to strengthen what we already have. So things like, and which have always been part and parcel of nursing, like rigor in data collection, like infection prevention and control, which COVID has now brought front and center to all of us, that nurses have been doing for years. If I can even remember when I worked in the hospital, that that was part and parcel of our work to make sure that infection prevention and control, you know, were there. And so, Elizabeth, because of time, I would like to just take a few questions from the chat box, and I will ask my colleague at UGHE, who's the Director for Executive Education, Professor Paul Cadet, to perhaps see if there are any questions that have come out of this really scintillating conversation with Elizabeth. Paul?
Thank you. Thank you. And thank you very much, Ms. Iro, for your really invigorating discussion and presentation, and for joining us. I have a few questions here from a few participants, and if we have time, we only have 10 more minutes, but please throw in your question in the Q&A box in case you have any more. The first question that I have for you, Ms. Iro, is could you possibly reiterate, this was asked by one of our participants, the key points that can be focused on in order to empower nurses and midwives' capabilities to become leaders?
Thank you, Paul. I think that's a really kind of, you know, interesting question. You know, if there are any key points that will focus on empowering nurses and midwives' capability to be nursing leaders. I think there are many lessons, many points to be considered. But I think to empower nurses, we come in with a focus around that we don't have power. I think we have power to influence. Everyone has power to influence change. And so I think, you know, as nursing leaders, we have this ability. And I think our nursing practice in itself teaches us the positive outcomes of the work that you do, whether you're in clinical practice or whether you're in academia. The influence that you have through the key elements of teaching to students, to nurses, or to your patients, I think can't be understated. I think those are key elements. You can kind of focus on some of the higher level policy agendas. I think this is, for me, it's about understanding, again, the political environment that you're in. I think this leads to empowerment, understanding that, understanding your role in influencing the change in your environment are key elements. If I can perhaps pause there. I hope that's answering that question.
Thank you. Thank you. That's a wonderful answer. Can I ask you, this is another participant. Thank you for this very important initiative, UGHE, and Elizabeth, for your experience sharing and advocacy. So this is a participant who's working towards improving anesthesia and surgical outcomes. And they ask, how do you perceive the role of nurses and midwives, specifically in improving surgical, nursing, and midwifery care, and bringing the very much needed improvement, and especially safety and quality, towards surgical healthcare services?
Okay, that's we kind of understand that a little bit more.
Should I break it down?
Get it right. No, it's fine.
Okay.
I'm just trying to understand the question itself and the role of nurses and midwives, how they contribute to surgical nursing care.
Yeah.
Specific. I think this is quite a specific aspect of nursing. We have programs that allow an advanced practice in certain specific areas. And I think this is one of those areas of speciality. And I think this is also very important as we kind of, work towards better health outcome for our patients. Sometimes we do have to branch out and take on these specialty programs that are offered. And I think that in itself contributes to quality. And I think that's the important word for me inside this, is that, we must be practicing quality. We must be teaching quality, because I think that's what gets people well quicker and out of hospitals, and keeps them out of hospitals. So I think that's the important focus. The additional training, of course, is where some of these elements are further enhanced.
Thank you very much for that. I have a question here. You brought up the term interdisciplinarity quite frequently, and it's something that I believe there's no way to address complex challenges in disciplinary silos, and you really need to conquer that interdisciplinarity. So this person is asking, when you're talking about interdisciplinary collaboration and referral as a key part of building nursing capacity, how can other professions and disciplines within global health better support the nurse and midwife's positions in terms of giving them a seat at decision-making tables, including their role in the interdisciplinarity?
Well, I'm not sure about them giving seats up at the table. I think we know how it is. People want to keep their seats at the table, but I think what is important here is if we take it back a step and find the nurse's role in this interdisciplinary approach to healthcare. You will probably, in many instances, find that it's the nurse who is the link to making this happen. So I think, we understand the various elements and needs of a patient that requires the different disciplines to have those entry points into the care of a patient. That's really critical. I think we need to kind of, put that aspect very early on in a training process. Where is it that it's possible to have this interdisciplinary education that allows our nurses to do that? And I think, you will probably find that you will earn your own seat at the table because you understand the strength you have within this team of multidisciplinary professionals. And I think that's going to be the key to kind of like giving you that seat at the table. And I think we just need to articulate this well, so everybody understands the key role that nurses play in multidisciplinary teams.
Thank you very much for that answer. I have a question here, and I think we only have time for one more question. But I have a question here specifically about the role of nurses in policymaking, what do you see as the role of nurses in local, state, and multilateral policymaking? And do you see them as being capable, or especially from your own experience, as being able to lead this policymaking and policy implementation?
I think, what we have found through those strategic documents I mentioned earlier on is that we do have government chief nursing officers in countries. Some may not be capacitated to really lead in the work that they do in policy making, but some are actually very much engaged at the highest level in policy decision making and policy dialogue and policy decision making within their governments and within their ministries of health. So I think there are capabilities, but what I find is that we need to still strengthen and support our government chief nursing officers to take the lead in this area. And it is about, you're right, it is about engaging across ministries. It is about engaging with finance ministries, with health ministries, education ministries, social welfare ministries. But I think that's what I'm so excited about, the nursing leadership programs that are being developed lately, is with this understanding that that's where we need to be providing support for our government chief nursing officers to make sure that their seats at the table is theirs, and they're utilizing that platform to make decisions on policy changes that's going to make the difference for nursing and midwifery overall in their countries. So I'm very excited that with what's happening already from your program and also various other nursing leadership programs that's actually being rolled out in various formats.
Well, thank you so much, and thank you for your very informative answers. And I'll turn it over to Judy now.
Thank you, Paul.
Thank you.
Thank you, Paul. Thank you so much, Elizabeth. And I think you've said it so well, because this executive education program is really targeted at the government chief nursing officers in the various countries, with the aim that they are then able to support policy. And I always come back to say, never forgetting that even if you sit at that high policy decision-making table, the work that you do must impact the patient right down at the bottom, who is our raison d'etre, as they say. So really, Elizabeth, we are almost at the top of the hour. I just want to thank you so much for your time, for sharing your experiences with us, and for giving us that kernel of truth that sometimes I think we forget in our day-to-day work around nursing and midwifery. And I'm grateful to all of you who've been able to be part and parcel of this webinar this afternoon, this morning, if you're there, to just ask you, we will have, inform you, we'll have a full recording on our website in a day or so. And we are opening up applications for this program from the 1st of April through to the 31st of May. Please log on and apply for this program. And like we've said throughout the webinar this afternoon, the aim really being to strengthen nursing and midwifery leadership so that the care of our people here in Africa is equitable, is quality, through the work that nurses and midwives play in their unique role and contribution to healthcare. Thank you, colleagues. Thank you, everybody. And I wish you a good rest of your afternoon. Goodbye.
Thank you, Judy. Take care.